Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Brittany Yerkes. Thank you for coming in today.
Thank you for having me.
You are a physician's assistant and you're an infectious disease provider for Chase Brexton Healthcare.
Yeah. But
more importantly, you are in the know for the region because you do consulting at Wicomico, Worcester, and Somerset counties. And your area of specialty is hepatitis C and HIV. But today we're going to focus on hepatitis C. I know you were anxious to come in and talk about it because there's a lot going on with regards to Hep C. But let's first, before we get into the numbers and all the particulars, first tell us what hepatitis A are, remind us about hepatitis A and B, and then where C falls into that picture, and then we'll move forward from there.
Sure. Thanks again for having me. So there's several different types of hepatitis viruses. The common three that you mentioned. So hepatitis A is transmitted by infected food or water. It's a fecal-oral route, and so typically you don't see it much in the United States. We see it in underdeveloped worlds, and occasionally there are outbreaks in the States of infected food products, but there is a vaccination for hepatitis A. Hepatitis B is passed typically sexually or through the blood, and so all babies born in the U.S. are vaccinated or offered vaccination for hepatitis B, although we still do see cases of hepatitis B. It is unfortunately not curable, but again, we do have a vaccine for it. And then hepatitis C is passed blood to blood. And so there are occasions that it can be passed sexually. It's most often with men who have sex with men, so that population. But there's no vaccination for hepatitis C, and we're seeing a real rise in the numbers of hepatitis C. But now there is curative, excellent treatment for it, so that's why we want to kind of get the word out and start talking more about it.
Well, I know one of the reasons we want to talk about it is you can walk around with hepatitis C infection and not know it for years. And of course now we do have treatment. Although there's no vaccine, there's treatment. And we need to identify it because there can be some serious consequences if people have hepatitis C and don't know it.
Absolutely. So there are a number of risk factors that are important to identify about who should be tested for hepatitis C. The CDC put out a recommendation back in 2012 for all baby boomers, so born between 1945 and 1965, to get a hepatitis C test at least once. And that's because a lot of people were infected in the 70s, in the era of the drugs and sexual revolution. Mm-hmm. And so we're seeing a lot of hepatitis C infections in the baby boomer population, actually about 75% of new infections that have been identified are in the baby boomers. But there's also risk factors including using intravenous drugs even just once because it's easily passed with needle sharing, getting tattoos done either at a non-professional site or when someone's incarcerated. And again, like I mentioned, men who have sex with men are also kind of the risk factors that people should be aware of who should be screened.
And not so much heterosexual sex.
Not very commonly at all is it passed through heterosexual sex.
And give us some other numbers about the prevalence of hepatitis C and why it's so important to identify cases.
So it's estimated that in the United States, about 1% of the population lives with hepatitis C. So of around 300 million people, it's estimated that about 3 million people are chronically infected. Of those, not nearly 50% even are diagnosed, and much, much fewer are assumed to have been cured. And so if you look at the numbers or estimate that on a local population scale, so Wicomico County has about 100,000 people, I think was relatively the last census. And so if you look at 1% of that is still a very high number. And looking at the numbers of people that we are seeing, we're identifying that are being cured is much, much lower. In terms of Wicomico County, each year, the number of chronic Hep C cases to be reported to the health department has been around 200 or 300, maybe 200. But again, Hep C is not a reportable disease. So that is more physicians reporting to the health department as good nature, not necessarily is it like HIV or tuberculosis where all positive cases need to be reported. So my suspicion is that number is much, much lower. Or much higher in general. And so we're just we don't have good data locally.
Well, and then I know one thing I've always heard about Hep C, because you can walk around with it for years and not know, it's doing damage to your liver. And it can be a very common indication for needing a liver transplant someday. It can cause cirrhosis, predispose you to liver cancer.
Absolutely. So most people who live with Hep C have no symptoms. When you first get infected with hepatitis C, sometimes people do go into an acute phase and have symptoms, but they can be pretty nonspecific, so flu-like, nausea, and then they'll resolve. Out of 100% of people who get exposed, 80% will develop chronic infection. And then over 20 to 25 years, about 25 to 30% of people will develop liver cirrhosis. And then from liver cirrhosis, an additional 25 to 30% of people can develop liver failure or liver cancer. And so now hepatitis C has become the leading cause of death over the combination of all infectious diseases, so including tuberculosis, Hep B, and HIV. More people are dying from complications of hepatitis C than all those other combined.
That is really startling statistics there. So I guess one of the roles of the health department then is to get the word out on how important it is to screen for this?
Absolutely. And so we were hoping that when the CDC recommendations came out in 2012, you would see a lot of people getting tested and diagnosed. But education is difficult. It's hard to get the word out. It's hard for people not only to understand their risk factors and their need to get screened, but for doctors and providers to recognize the risk factors that their patients may be. Talking about a history of drug use or your sexual preferences can be challenging, even with people who know their providers for a long time or feel very comfortable with them. So it's certainly something that people maybe not recognize that they're at risk for, not asking about. And on the other hand, providers and primary care offices who may not be regularly screening because they're underestimating the risk their patients are at.
I know you also wanted to mention that there are some certain situations where people might progress faster with some of these untoward effects.
Absolutely. So the risk factors for elevated liver damage or fibrosis. So kind of when you get infected with the virus, like I said, it's most commonly asymptomatic, but that virus is causing kind of low-grade inflammation of the liver. Inflammation over time can cause liver scarring, and we call that fibrosis. When that fibrosis accumulates enough in the liver, that's when you have liver cirrhosis. So the things that can cause that to speed up in someone are men seem to progress more quickly than women, older age, so as people get older, they tend to progress more quickly, HIV co-infection, also alcohol use, and that's a major one. So anybody living with hepatitis C or anybody diagnosed with Hep C who's not been treated yet is recommended to avoid any type of alcohol. So those are kind of the main four risk factors for progression that we worry about. But there's no test to tell who will progress more quickly than someone else. Someone may get infected and in 10 years have liver cirrhosis. Someone may get infected and in 10 years have no damage. It's very hard. There's no genetic test or marker to identify those people that are going to be the ones to progress to cirrhosis and failure.
I know for years we didn't have a blood test, but how long has the blood test been around? It's just a matter of getting people tested.
Yeah, so we've identified the virus in the early 90s, I think 1992, and we could identify the virus pretty early through the screening test. So the Hep C antibody test is the screening test that we use to tell if someone has been exposed. That has been around for a long time, but I think the thing is that people weren't testing because we didn't have great treatment. So the treatment for hepatitis C from starting back in the 70s was to use interferon, which are injections of just a very, very nasty drug for a year, and people had to take it via IM shots with ribavirin, which is another medicine that has just terrible side effects. So for a long time, we had really difficult treatment to take. It made people very sick, and it didn't work that well. So honestly, people, I think, weren't screening as often because you may identify it, but what are you going to do about it? And so not until did we start to get the newer agents to treat and cure hepatitis C that were really tolerable and effective, did this kind of start to become more of a push to identify people who are living with this, because you may have been identified before, but we just didn't have good options.
Right, because you're saying the interferon wasn't curative.
It did cure maybe 20 to 30% of people who got cured for or got treated for a year. So if you made it through treatment, if you could tolerate it,
stuck with it,
exactly. So it was really nasty back then.
So let's get to the good news, which is we have some curative treatments now that you can take by mouth, combination drugs. Tell us about those.
Yeah, so about probably in 2011, the first group of direct-acting antivirals came out, and they were still kind of difficult to take. We treated people and maybe had about a 70% cure rate. And then a few years later, the combination product of ledipasvir and sofosbuvir, which is also known as Harvoni, came out. And that was really groundbreaking. We saw really high cure rates. I mean, 95, 97% of people getting cured, even people with liver cirrhosis. And then since then, we've had several new products come out in combination that most people can take without needing ribavirin, which is kind of a booster agent that we used with interferon before. So you don't need the ribavirin, so you don't have the side effects of that. These medicines can typically be taken generally for 12 weeks, some now for 8 weeks. Orally, many are once a day, and like I said, the side effects are quite minimal. So less than 5% of people in the studies complained of side effects, and typically some fatigue, some nausea, trouble sleeping, headache, things like that. But they are far more tolerable and far, far more effective than our standard treatment that we've had, before.
And you're saying the interferon were injections for up to a year. And how long do they take these drugs by mouth?
8 weeks to 12 weeks. There are occasionally people that we need to treat for longer, 16 or 24, based on if you've ever been treated before, possibly in the interferon era and failed that, if you have more advanced disease. But generally, most people can get treated in 8 to 12 weeks, and then they are cured. They're free of the hepatitis C virus, and that's remarkable. We haven't been able to say that in a long time.
That is really good news. I know I teach in the nursing program about Hep C, and for years it was like, we have nothing. We don't have a vaccine either.
Exactly.
Where are we in a vaccine? Are they working on a vaccine?
I don't know much about the development of vaccine right now. I kind of follow the HIV vaccination a little bit closer. I don't know if they're coming up with a Hep C vaccine. I mean, at this point, because treatment is so easy and curative, I think the focus more is on getting people access to it. So if we can get a number of people access to Hep C treatment and cured, I mean, I don't like to associate it like an STD, but it's almost kind of following that progression. So it's an 8-week course of treatment. So if we can eradicate this quickly, if we can identify people who are infected and get the lion's share of people who are infected cured, then we're going to see our rates drop dramatically. There may not be a need for a countrywide vaccination program.
Sounds like it'd be more cost effective to just treat the cases that you have.
And that's what I think our hope is we can get to. The problem is we know there's a lot of people living with Hep C, and just not many have been identified yet. So we're still kind of on the early uptick of the hill to try to get these people tested.
So I guess that sounds like a good way to segue to our take-home point, which is?
So hepatitis C is a virus that you can live with chronically and have no infection, but that we can cure. So it's really important that people understand the risk factors for hepatitis C, know who may be at risk, and ask their providers about it. Have I been screened? And if I haven't, can I be screened? And so, like I said, it's not always up to the provider to know every single thing about their patients' lives. So be accountable for you know, the decisions and risk factors you may have in your life, and ask about it. It's a very easy blood test. It doesn't show up on routine blood testing that you may get at your physical. And so it's just something that people can kind of take ownership of and ask if they've been screened and identified, and then get referred for treatment, because it's quite easy to achieve cure now and not face that road of really dangerous complications.
And is this more pertinent now to be an advocate, or hopefully your physician asks you, with this opioid crisis going on and a lot of drug use via IV methods? Isn't that a concern these days?
Absolutely. I mean, with the opiate epidemic and the increased deaths related to opiates and to heroin, we know it's out there. We know that people are using in rapid numbers. I mean, the Maryland numbers are just pretty astounding. And so with the transfer of needles and blood comes the infection of hepatitis C. So we're seeing a lot of young people and older people who have a history of IV drug use infected. And that's just, it's so hard to see that, because you know what's going to happen. You know that the hepatitis virus is going to continue to progress and cause further damage. And if you don't kind of treat the substance abuse along with the Hep C, you have to look at both of, look at both of them. But it is something that people can get cured from, as long as they're forthright about their risk factors, and you know, and we're just seeing a lot more of it now. So it's definitely something that should be on the forefront radar of physicians and of mid-levels and all providers who are doing routine screenings for people.
So if your provider doesn't mention it to you, you should definitely bring it up to them.
Absolutely.
Be proactive about your health and ask about the Hep C screening, particularly baby boomers.
Absolutely. And you know, a lot of people who initiate care into a new practice will get a routine, you know, slew of testing that may include Hep C testing, because it's part of a hepatitis panel for vaccination status. But if you've been with your provider for 20 years and you get the same blood work done on your physical every time you go in, it may be something just to bring up. And you may have been screened 4 years ago or 5 years ago when it came out, but it doesn't hurt to ask.
Never does. And so exciting now that we have curative treatment for this.
Absolutely, absolutely. And the hardest part too is finding somebody local to treat you, because it is a specialized part of medicine and part of treatment. But do the work. There are local providers treating, some of the gastroenterologists are treating, some primary cares are treating, and so we're hopefully trying to get education out so more people not only get tested, but there's more people who, providers who will start treating as well. That's an important piece of it.
Well, you can always go to the local health department, can you, to get treatment and or referral?
You can certainly get referral through there, yeah. And the local health departments are working on testing programs. So Wicomico and Worcester and Somerset County, they will all be starting testing programs in the next couple months. So right now, I don't think it's part of their routine screening. If you go in and you want to get tested, you know, say for TB or certain other STIs, but they have started the process to start routinely testing and then referring out. So that's another great resource to go to, not only for information, but to get screened. Hopefully we're going to be seeing that rolling out.
Well, I know another barrier can be the cost of the medication. So how can that be addressed for some people that may not have insurance?
Absolutely. So yeah, the medications are quite expensive. The newer agents, thankfully, are a bit cheaper, but I mean, we're talking tens of thousands of dollars for a 12 or 8 week course of treatment. So right now, luckily, Medicare is covering a lot of cost. Primary or private insurers are covering a lot of the costs. The local Medicaid plans, like the Maryland Medicaid plans, will pay for treatment depending on the stage of your liver disease. So how much liver damage you have will kind of qualify you for treatment. But for people who are living without insurance, most of the drug companies that make these drugs have patient assistance programs that will provide free drug to people without insurance. Now, again, you've got to see a provider and get your labs done. So all of that is important too in kind of identifying and working people up for treatment. But they will provide free drug. There's patient assistance programs that I've used for access for people and have had good success with. So we're still trying to work on getting access to more people because of kind of the restrictions that some insurance companies are putting on us. But so far, I think that the insurance companies have recognized, hey, if we treat people when they're well and they don't have liver disease, you may never get to that point where you're going to need, you know, transplant.
Right, that's
possibly.
very expensive.
Absolutely.
And quality of life and such, so it makes perfect sense. But you always have to ask about the money piece.
Oh yeah, it's unfortunately very, very expensive ticket prices on those drugs. But we're seeing people with copays of under $5 for the 12 weeks. So they can be really affordable if you are getting into the right assistance programs and if your insurance covers it. And we've got really good people like in my office who kind of work with the insurance companies and fight and advocate for patients. So it's getting better.
That's good.
Yeah.
So there's a cure and there's some assistance for the
yes,
medications.
absolutely. There is.
Well, Brittany, thank you so much for being on the program. Certainly a wealth of knowledge on a topic that we just need to get the word out more so on.
I thank you for inviting me because that is definitely something on the shore that I am working toward and trying to get more people aware of and understanding a little bit about it, just enough to have a conversation with their doctors about. So
exactly. And we'll post some websites at the end of the program as well where our viewers can get more information.
Okay.
And thank you for joining us for this edition of Focus on Health here on PAC 14.